Hello, I'm Dr. George Ampat, consultant orthopaedic surgeon working in Liverpool in United Kingdom. Today, I'm going to talk briefly about microaggressions. Before we begin, I want to make something very clear. None of us are perfect. We have all made mistakes. The aim of this video is not to blame or shame anyone, but rather to educate and reflect on how we can move forward together. It's also possible that some of the examples I share may bring up difficult memories or emotions. If you find any of this distressing, I apologize and please do consider reaching out to one of the support organizations listed here and at the end of this talk. What is the definition of microaggression? The term microaggression was first defined by Gerald Wing Su in his book published in 2010 and later reinforced in the second edition in 2020. He described microaggressions as brief and commonplace daily, verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative racial, gender, sexual orientation, or religious slights and insults to the target person or group. Perpetrators are often unaware that they have engaged in behavior which demeans the recipient. It is important to remember that microaggressions are usually minor misdemeanors, and often even the person responsible doesn't realize that they have caused offense. Sometimes the recipient may also not realize they have been offended until later. A simple example. Let me give a simple example. Imagine a trauma meeting in an orthopedic department. The clinical director is white, and one of the consultants attending is a South Asian. During a friendly, private chat, not publicly, the clinical director asked the Asian consultant, "When are you retiring?" Nothing more is said. The Asian consultant replies, "Not for the next 5 years," and the trauma meeting continues as normal. Following the trauma meeting, each of them go to their respective work areas. Now, the clinical director's intention was not malicious. In fact, he was hoping to identify someone to lead a new prehabilitation project and wanted to know if the South Asian consultant would still be around for the next few years to take that on. He, however, did not make that clear. However, intent is not what matters. Impact is. The Asian consultant may have interpreted the question differently. Why is he asking me that? Does he want me to leave? Is a departmental reorganization coming? Could I lose my job? What about my daughter's university fees? My mortgage? Although no harm was intended, the impact was significant. This is what we mean by microaggressions. Small, often unintended comments or behaviors that can cause disproportionate distress or harm. Types of microaggression. There are 3 main types of microaggressions. The first is microassault, then microinsult, and the third, microinvalidation. Microassaults are often conscious and deliberate, intended to hurt or insult, though expressed subtly enough to avoid formal complaint. Example, telling a joke about a person who identifies as gay, then saying, "I was only joking." Microinsults, however, are usually unconscious. Example, saying to an Indian colleague after a presentation, "You are so articulate," implying surprise that someone Indian can speak so well. Or saying, to have got this job as a woman is amazing, implying that women are less capable. Microinvalidations are unconscious actions or statements that negate or dismiss someone's identity or experiences. Example, saying, I don't see color. I see everyone the same. This may sound positive, but it denies the reality of people's different lived experiences and the importance of celebrating diversity. Forms of microaggression. Microaggressions can take three forms. The first is verbal, spoken comments such as, "You're so smart for a woman." 2. Behavioral, actions that exclude or ignore someone, such as a bartender serving white customers before a black customer who arrived earlier. 3. Environmental, lack of representation, such as hospital corridors lined only with portraits of white male scholars, despite the contributions of many diverse individuals to medical science. I'm an orthopedic surgeon and I like to get an orthopedic example. The stress fracture analogy. In orthopedics, we understand this concept well. A normal fracture might happen if you drop a 100-kilogram weight on the leg. A single large trauma. A stress fracture, however, results from repeated small stresses over time. Each impact is minor, but together they cause injury. Microaggressions work the same way. Individually small, but collectively damaging. Roles in microaggression. In any microaggression scenario, there are usually at least 2, sometimes 3 parties involved. 1, the source, the person committing the act. 2, the recipient, the person affected. 3, bystanders who witness it. All 3 have roles to play in recognizing and addressing what happens. The ICE model. We propose the ICE model to help address microaggressions. I, impact, not intent. C, curiosity, not confrontation. E, empathy and education. Now looking at the first, impact, not intent. In the earlier example, the clinical director's intent was good, but the impact was harmful. It is essential to educate the clinical director that even without bad intent, his words had an unintended negative impact, and that as a leader, his language carries weight. Curiosity, not confrontation. The Asian consultant could respond with curiosity rather than anger. Instead of saying, "You're racist," he could ask, "May I ask what made you ask that question?" This opens dialogue rather than defensiveness, allowing both people to learn. Empathy and education. Empathy is vital for the recipient, but it's equally important that the source learns from the situation. Many microaggressions happen unintentionally, so both sides benefit from the understanding and reflection. As Harper Lee wrote in To Kill a Mockingbird, you never really understand a person until you consider things from his point of view, until you climb into his skin and walk around in it. We must look beyond our own perspective and recognize how our words and actions may affect others. A scenario for reflection. Let's consider a ward round scenario. The characters are Mr. Jones, an 82-year-old patient, a male consultant, a male registrar, and a male FY1, all white. Cynthia, a black nurse. Rachel, a nurse from Philippines. The scenario. An 82-year-old male, Mr. Jones, is admitted from A&E to the acute medical unit. Upon entering the room, the team finds a somnolent Mr. Jones dozing off while having his breakfast. He becomes more alert and looks around the room at the team. A male consultant, a male registrar, a male FY1, and 2 female nurses. A Filipino nurse called Rachel and a black nurse called Cynthia. When Mr. Jones sees the team, he points to Cynthia and states loudly, "I do not want her here." The consultant then asks Cynthia to check on the next patient by way of excusing her, and she leaves the room. Changing the subject, the registrar asks the patient if he has been offered a good level of care. "Of course. In fact, that's my favorite nurse," he states with a smile, motioning to Rachel. Later, when examining the patient and assessing Mr. Jones's pupillary reaction, the consultant asks him to focus on a spot across the room. He makes eye contact with Rachel and asserts slyly, "I can focus on her all day. Where are you from anyway?" The team concludes the visit and leaves the room, where they reconnect with Cynthia. While discussing the medical plan for Mr. Jones, the consultant states to the team that he feels they handled the interaction professionally. I'll just revise a few of the statements that were made. First is Mr. Jones's statement, "I do not want her here." And the next one is the consultant making the statement, "Hi Cynthia, please can you check on the next patient?" Obviously, Cynthia goes out after that. The next statement that the patient makes is about Rachel. "I can focus on her all day. Where are you from anyway?" Then the team leave Mr. Jones and they regroup outside. And when they regroup outside, the consultant says, "I think we handled the interaction professionally." I leave you to think about this scenario. The questions are, where were the microaggressions? What types were they? What was their impact on Cynthia, Rachel, and the rest of the team? How could the situation have been handled differently? So to conclude, microaggressions are often small and unintentional, but their effects can be profound. If anything we have discussed today has caused you discomfort or distress, please seek support through the appropriate organizations. Thank you very much for listening. If you found this helpful, please like, share, and subscribe. Do interact by providing some comments. Thank you so much. Goodbye.